Hey everybody, it's Mika. I just wanted to bring this video to you today because I wanted to talk about a position that I did that I didn't really tell many people about. I was a contact tracer here in the state that I live in, which is New Jersey, and I did that starting the week of Thanksgiving in 2020, and I did it up until the end of May of this year. So I just wanted to go over it, answer some questions that some people may have had, try to debunk some myths that people had or misconceptions people had about contact tracers and what we actually did. So let's just jump right into it. Okay, so the requirements, the job requirements to be a contact tracer were having a bachelor's degree. It was great, but it wasn't necessarily a requirement. I have a bachelor's degree in social work, so that definitely gave me a leg up over other people. They also wanted people that either had call center experience or customer service experience, which I have the customer service experience down pat because I worked in retail for several years while I was in college, as well as, when you're working for organizations, you are required to give a certain level of service, and customer service falls right in the queue with that. So I definitely checked off all the boxes when I was applying for this job. They also wanted people who had, a newer laptop, Windows 10, very good security on their laptop. So what I did, because I had the funds to do so, I actually upgraded my laptop because it was long overdue. I'm the type of person, because since I do a lot of writing on my laptops, I actually wrote my first 3 books on my old laptop. So I had a lot of attachment to my laptop. That may sound stupid to some people, but that's just how I am. I had a huge emotional attachment to my old laptop because I had it since I had gone back to school for social work. I bought it during that time and I had kept it over the past 10 years. So yeah, let's just say that I wasn't too thrilled about buying a new laptop, but at the same time, once I got it, I was like, oh, where have you been? It was so much faster. It had so much more space. So it all worked out for me. It really did. And the money that I spent to purchase the laptop, I made that back in spades with my contact tracing job. So moving on. So I applied for the job. I got a response from one of the 2 staffing agencies that were contracted to do the hiring for the contact tracer position here in New Jersey. And we exchanged a few emails, and then we did a very brief phone interview. I mean, it was great. It was very fast, like super fast. But, honestly, at the end of the day, she knew that I was a good candidate for the job and that I could do it well. So I got hired, and I started with a group that started on, I want to say it was a Monday, maybe November 23rd. Started, and basically obviously it was a remote position. I just want to put that out there. I know that maybe some of the counties had contact tracers that were actually coming into their local health department offices at the time during the pandemic, but that was not me, and that was not a lot of other contact tracers that started with me. Yeah, we were working remotely from home, so that was a huge plus and perk of the position. So started the training, and from the jump, there was definitely a push for us to do the training and get through it very fast. It was kind of like a rushed feeling. And at times, it felt kind of overwhelming because there was a lot of information that we had to cover. And again, you're doing all of this online, and, if you have questions, there were people that you could contact for help, but it was definitely the type of training experience that if you're a good self-learner, you would do well in that. And of course, I don't think everybody passed. That's usually just how the way it goes. I don't know for sure. I wasn't in charge of hiring, so I don't know, but I'm sure there were some people that did not complete the training and did not move forward with the position. But anyway, I finished the training, and I finished it, I want to say, I started that 23rd. Thanksgiving was that week on that Thursday. Yeah. And basically they wanted us done by Black Friday. That was like the cutoff, the deadline. So yeah, a lot of pressure to get that done, but I did it. Honestly, like I've said before, you can't really be a social worker if you don't do well under pressure and can't handle stressful situations. And if that's not for you, then it's not. So, past training, and we were told we were going to be assigned a supervisor very soon. They were doing a lot of hiring. I came in during the second wave of COVID. You know, it had kind of quieted down during the summer and even into the early fall, and then it spiked up again around back to school time, and then as we went into autumn, so around like October and November, that's when the state of New Jersey was doing a lot of hiring, a lot. So once we got started, it was kind of like a waiting game. It really was. Between the week of Thanksgiving and all of December, I wasn't really doing necessarily contact tracing. Like, I didn't have my own cases yet. What I was responsible for were contacting travelers, because contact tracers, I can't speak for all, but a select number of contact tracers were assigned to the travel advisory board. And so we would contact people that had flown recently, you know, just to check in on them, see if they had experienced any symptoms, and then, you know, give them any information that they might need, like, you know, where they can get tested. You know, giving out information for testing sites was very important, as well as making sure that they had enough food and medical supplies or cleaning supplies while they quarantined. And just answering any other questions that they might have for us, definitely. So that's basically what I did throughout most of the remainder of the holiday season. And then, I kid you not, boom, New Year's Day hits. Guess what? I had to start my actual position on New Year's Day. Yeah, that was a shock. It really was. I wasn't expecting it to be on New Year's Day. So yeah, I mean, it kind of put a damper on my New Year's Eve. I don't really drink anymore for personal and health reasons, honestly. I mean, it's just not for me. And also, I've mentioned in previous videos that I have an underactive thyroid. And for those of you that don't know, alcohol suppresses the thyroid gland. So if yours isn't functioning well to begin with, alcohol is the least, the last thing you should be putting into your body is alcohol. Just putting that out there if you have a thyroid issue. So started work on New Year's Day, and the phone lines were very quiet. What we were using, we weren't giving like cell phones. We were using a system through our laptops, which was great. And all I really had to do was buy some earphones that had a microphone to it, and I was good to go. And that's how I worked from home. And where I'm sitting now is where I ended up doing the majority of my position. Like, I started off in my home office, which I do have. But then after a while, you know, when I got comfortable and used to everything, I just kind of moved around the house, like where I felt comfortable that particular day. So I did a lot of it here in the living room and also the bedroom sometimes too, if I wasn't really feeling too well or if I was just kind of tired. I would just prop myself up, have everything on the bed, and again, I was able to do my job from wherever, which was nice. That was probably one of the biggest perks of the position. So then, you know, I was so nervous my first day, but it actually went very well because since it was a holiday, I think a lot of people weren't calling into the hotline, you know, for general questions or callbacks from other people that had called them. That's another thing. Like, even though we were assigned our own cases and contacts were assigned to us in the system, we also worked the phone line for our particular county that we were assigned to. So, you know, on a given day, I could get a call from a different city than the one that I was assigned to for the local health department, which was fine. You know, it kind of got a little tricky at times because certain local health departments did things a little bit differently than the one that I was actually assigned to, but it is what it is. So, you know, just, there's that flexibility. Had to be flexible. And it was cool. So then, my first supervisor was great. We didn't have her for too long. She was transferred to a different unit. So then I got my second supervisor, who's the supervisor I had like basically the longest time that I was employed there. And it was cool. It was very structured, which was nice, but also flexible too. It wasn't like rigid by any means. Like, as long as you were basically doing your job, they didn't really like hark on you or hassle you. So that was a perk, no real micro managing to deal with. We did have town hall meetings. They started off being weekly, and then they decreased to bi-weekly towards the end of my time there. And that was cool too. The town hall meetings were very colorful. That's the best way I can describe it. It was a safe space to air out your grievances, kind of like Festivus for you people that like Seinfeld like I do. Festivus, which is actually on my birthday. Yeah, I looked it up. It's crazy. Festivus actually lands on my actual birthday. The town hall meetings were a place for people to ask questions, and some people were calmer and nicer than others. And I'll leave it at that. But now the people that handled and ran the town hall meetings, they did a pretty good job of, handling tempers and all that good stuff. So yeah, the job, I don't want this to run too long. So basically, I'll start with the worst part of the job. Obviously, the worst part of the job was dealing with people that were sick. And when people are sick, they're cranky. They don't feel like talking to you, especially if there's already apprehension and, a distrust of giving out personal information over the phone. I totally get it. I'm totally right there with them, and I totally understand. I was very considerate when I was talking to people, and, I knew that I shouldn't be taking anything they said personally, because it wasn't me. It was the actual job and the actual situation that they were upset about. It wasn't me personally. So you kind of had to go with the flow. Yes, I had people that were very irate, that were very stressed. I dealt with a lot of parents, because again, it wasn't just adults that were catching this virus. It was children and adolescents as well. And we were not allowed to speak to anyone who was under the age of 18. We had to speak to parent or guardian. So yeah, I get these parents and these guardians wanted to be protective. I would be too. So, that was the worst part, just trying to, break through the wall that a lot of people had and to develop rapport over the phone. It was just not always easy. It really wasn't. And I did have my fair share of people who just hung up on me and didn't, want to complete the interview, which again, that was their right. They had every right to do that, and it's not like I was calling them back and saying, no, you have to talk to me. No, it wasn't like that. It wasn't, not at all. And another bad part about the job were the really sick people that I had to talk to. And a lot of times I had people that were so sick, they were hospitalized, or they just couldn't get to the phone. So I had to speak to a spouse, or a family member that was in the home as well. And yeah, I did have people that passed away. They weren't personal to me, but, I kind of took it personally because they were assigned to me. And, I take my jobs very seriously as a social worker. And, whenever I lost a case, I took it hard. It was just really sad. And then you dealt with people that were just sad and lonely because they were sick and they lived alone and they didn't really have anybody, and everybody was still socially distancing, and it was just a lot. It really was a lot to deal with. I got into the habit of wearing my crystals, as I always do, and burning candles. This company called Jack's Kelly, they make some of the most delicious smelling candles I've ever used, and I bought black obsidian candle for dispersing negativity, and I used to burn it during my job I got into the habit of trying to keep those candles in stock and just burning them throughout my shift because, you know, if I wasn't calm or if I was holding on to a lot of that aggression that was being tossed at me, I wouldn't be any good to the other people that didn't deserve it, you know. And, you know, so just keeping myself healthy and protected was definitely tricky and trying at times. But yeah, so getting into going from, you know, the bad and the ugly to the really delightful people that I dealt with. Yes, there actually were some positive people that I spoke with, and that was awesome. They were funny, they were friendly, they actually appreciated somebody reaching out to them and asking questions or offering information. One of the biggest things that a lot of people probably don't know is that we did give out information to people. We gave out information on not only just where to get tested, but if they needed medical attention and medical services. We had the names of clinics and doctors' offices that were either federally run or used a sliding scale to help people, you know, get the treatment that they needed if they were uninsured. So, and also aside from medical assistance, food. I can't tell you how vital it was to give people information for organizations that we knew of that were helping assist people that were quarantining and isolating. And yes, there is a difference between the two. Everybody was using the word quarantine and isolating like interchangeably, but there is actually a difference. People were quarantining if they were basically exposed to someone and at risk of catching COVID-19. And isolation was for people who actually had tested positive and, you know, were trying to get better. Quarantine was supposed to initially last for 14 days. Isolation was supposed to last for 10 days. And then, of course, there were, you know, exceptions to that rule as well. But in any case, I did have some delightful cases and contexts that I encountered. They were hilarious, some of them. And one of the best was this man who was born the year that the stock market crashed, like legit 1929. And speaking with him, you would have never thought that anything was wrong with him. He felt great. And he was probably one of the best people that I ever spoke to. Just a very positive mindset. And, you know, he was going to keep on keeping on and doing what he was doing. And also, you know, it was just really nice to be part of something that was trying to do good. You know, there were so many people that, you know, didn't want to deal with the phone call and tried to avoid us. But for the people that actually were willing to listen to us and the people that I really did try to contact and finally did reach, a lot of times it was a positive experience. Not always. I could laugh about it now. Not always, but a lot of times it was. So I hope this video helped, you know, just kind of like pull back the curtain a little bit about what it was like to be a contact tracer. Yes, I've intentionally not spoken about the vaccine. That was a question that came up a lot as a contact tracer. Should they get it? Should they not? I'll tell you right now that we weren't supposed to give out any medical information. Like, we weren't able to diagnose or give suggestions or anything like that. So, you know, that was a plus, you know, and I always made sure to tell people just take it up with your primary care physician, you know. And as for the vaccine, you know, I can't really say for sure whether it helped or not. I can't say yes or no. I'll use my favorite line. I'm not at liberty to confirm nor deny that information. I will say I did have cases that had been vaccinated who they did test positive afterwards. You know, some did end up in the hospital according to the information that they gave me. So you know, it was a mixed bag. What can I say? But I hope that this video was helpful. And if you have any comments or suggestions for future videos, please pop them into the comments. Feel free to message me. And, you know, sharing is caring. So please do that with this video. Have a blessed day. Bye.